Mm-hmm. Good morning.
Good morning.
Good morning. So Sabrina's going to go ahead and read off some of your posts here, and then we'll kind of ask you a little bit about it.
Right. So you posted this on Facebook. It says, "Dear Governor, thank you for placing us in a place of unrest, uncertainty, and instability. Your leadership during this pandemic has pushed me into a mental state of fear and anxiety. Now that I've attended the orientation for my son's school this year, I am more in complete fear. I predict that as soon as my boss finds out that I cannot be at work 11 out of 15 days, that I will lose my job, and in a week my bedridden mother, myself, and my son will be homeless because, unlike you, we don't have any other income but the one I was providing. The continued closure of the senior care and dementia centers has tied my hands. The partial opening of schools have tied my hands. As the only adult and income provider, I cannot hire anyone to come and care for my mother and my son so I could work. How can we live on less than 20-hour week income? I worked hard for 5 years to earn just enough to not qualify for food stamp or housing assistance. I paid my taxes and my bills. Since you've come to office, I've lost the best insurance my money could buy. I'm losing my job and the security it provided. How is that your problem was about being a woman and empowering women, but I'm a woman and I'm losing everything? Why am I the only person on this island asking these questions? All of you keep telling me that we're in this together. Please provide me your information so that I can give it to my landlord, GPA, GWA, GTA, and all my other bills. Please send me a letter authorizing the use of your money so we can survive. Please make sure the letter is notarized. Some of you may laugh at my distress or roll your eye or dismiss me as being dramatic. You can go ahead. I'll be moving into your house with my son and my bedridden mom come August 8th. Please call GPA, GWA, GTA, NFCU, USDA. We just say you're paying for my bills. Send me a copy of the receipt and I'll thank you right here on Facebook."
Donna, thank you for this. Thank you for this. It's very courageous of you. It's stunning and brave that you would put this out there, especially when social media people are so quickly attacked for expressing opinions that are very valid. And these are very valid issues. What drove you to post this on Facebook?
I think it's a continuation of many of my posts since the decisions have been made. I think this one so today's supposed to be my last day because I don't know how I can meet the requirements of my job. But I know I'm afraid. I didn't want to cry, but Sabrina, when you read that, I'm just like thrown back into the decisions that they're making. And everyone is, I commend DP, Department of Public Health, GDOE, all the people that have been working, trying to keep our island afloat. And many families and many people on the island have reached out to help each other. I know families that are buying cases of chicken to share with families that don't have any money right now, who've lost jobs, especially those in the tourist industry, and not just tourist industry, just basic small families. I'm sorry, I'm crying.
No, Donna, I mean, this is something to cry about.
It's overwhelming. I run I have a group of friends that try and help people out. We're not like Juanita, who has this system that she has, but because, their hands are tied too, a lot of people are suffering. And honestly, we're coming to a point where we're not going to be able to help people. We're not going to be able to reach out to others because our hands are tied. Our income isn't that great. I mean, you guys know that, but still, people in Guam, they will use their last $20 to buy so that someone else doesn't get hungry, or share clothes that they could, maybe they only have 5 pairs of pants, but they'll give 2 away so that someone else can wear it. But everyone's trying their best, but I keep asking myself, what is the source of why we're having this problem? And it's the decisions that are being made. I'm so frustrated with this COVID team, advisors for the governor and all of that, because GDOE is trying to do their best, but everyone is afraid because of the way they're presenting their data. I don't understand how a doctor who spent 10 years studying and more so can't do a statistical analysis, simply get out a calculator and calculate what are we looking at. five deaths, and not to dismiss deaths or devalue their death, but 5 deaths in 4 months out of 180,000 people, that's 0.05%. And we are holding hostage our whole island. And I'm just so, I just can't believe people can't think. We're closing businesses, like, you know, good businesses, because one person walked in with supposedly asymptotic symptoms, right? But we don't even know if the tests themselves are actual positive tests. If you've gone through these tests, you're going to get a little piece of paper that says, even though you're negative, you still have to stay home for 14 days or 7 days because you may have something. You go to one testing site and they say, oh, you're not going to know the results until 7 days or 5 days later. But then they're posting it that night. 51 people were tested, 7 of them are positive. But when you go to these testing sites, you cannot have symptoms and get tested there. That means everyone that got tested there are asymptotic. And so what are they saying? That this disease is not causing people to be sick? If they're not getting sick, they're not in the hospital, they're not whatever, why are we holding this whole economy hostage? Why are families that are running businesses that paid 5% GRT closing down? Why? Why are we shutting down this economy? Why can't? And you know, my biggest test for this whole question is Payless. Payless has been open. Home Depot has been open. All of these so-called essential places that need to run to provide basic necessities for Guam have been open. Has anyone gone to Payless and tested these employees that have been exposed to everyone on Guam? Has anyone ever reported that Payless, you're telling me that all the people that walked into Payless since day one of March 16 and this announcement, not one person that walked into Payless had asymptotic symptoms. And Payless is been doing their best. They even put out this iPad that measures your temperature just so you can come into their store. But guess what? If you're asymptotic, then you don't have a temperature. You're still going to walk in. You're still going to be exposing people. So my question is, if they're asymptotic, is it contagious? Is it the same thing that's making someone severely sick? Is it the same strain that's causing people to die? If they're not, then why are people still walking around asymptotic and it's okay? Why are they having people come to one place to be tested, and you don't know if the person standing next to you or the person that's giving the test is asymptotic?
Donna,
because they don't have symptoms.
We definitely feel your frustration. Unfortunately, we got to move on to our next segment. But I wanted to bring you on because people feel what you're saying. They feel what you posted in their Facebook, and a lot of it is we just have this initial reaction where we just want to vent and put it out there, and that's what I really felt in your post. And we'll keep in touch. Let me know how it goes for you. Is there anywhere? It sounds like you really need help. We put your Facebook out. Is there any other help that you need that you want to ask people for?
I don't want help for myself. I want people to help others who don't have a job right now, who are stuck. That's the people I want you to help.
Okay, Donna.
Thanks, Donna.
God bless you, Donna.
God bless you guys too.
Take
Thank
care.
you.
Wash your hands and be safe, okay? And we'll pray for you. All right, 9:09. Let's do it. KUAM News decision.